name is Dr. Ganesh, Veerabhadraiah. I am a consultant neurosurgeon, brain, spine and neuroendovascular. Today, October 26th, it is observed that World Stroke Awareness. Today, we will speak about brain stroke. A brain stroke is also known as brain attack, occurs when the blood supply to the brain is reduced or stopped. This condition is similar to heart attack. What happens here? Due to blockage inside the vessel, there will be a stoppage of blood and oxygen reaching the brain. The most common symptoms of brain stroke are facial weakness, arm weakness, speech dysfunction, blurring of vision, imbalance while walking. What are the risk factors that make brain predisposed to stroke? Hypertension, diabetes, smoking, high cholesterol, obesity, ischemic heart disease and sedentary lifestyle. Brain too has golden hour like heart. Brain stroke is like heart attack. What one will do if suddenly develops chest pain, people will reach the hospital as early as possible, get ECG and ECHO and will take the opinion of the doctors, emergency physicians and cardiologist. Am I saying correct? Dear people, brain stroke is similar to heart stroke or heart attack. If warning signs are recognized soon, person if reaches the hospital in golden hour, the complications that arise from the brain stroke can be prevented or minimized and minimizes the disability that can arise from the brain stroke. Dear all, let us know how brain stroke happens. Let us imagine heart. Heart pumps blood into the brain through the blood vessels or channels called carotid arteries, which includes right and left carotids. If there is a lack of blood supply or blockage on one side of the brain, it causes brain stroke. During brain stroke, almost 1.9 million of neurons die each and every minute due to lack of blood supply. If not treated immediately, the damage will be severe. What that mean? That means important centers of the brain can get damaged permanently. Based on the damage happened to the brain, what all of us should know is brain stroke is classified into mini stroke and major stroke. Mini stroke is also known as TIA, transient ischemic attack. We will see usually with or without treatment, sometimes it will improve spontaneously. On contrast, what happens in major stroke is a person affected with major stroke will take time to get better. The weakness or neurological deficits persist for longer duration, which results what happens, the person may become permanently disabled. What is this golden hour? When brain stroke happens, we should take the patient to the stroke care hospital and seek immediate treatment within this golden period. It is almost 3.5 hours to 7.2 hours after the person suffers a stroke. It is very crucial and very important. And even as soon as patient develops stroke, up to 7.2 hours, this period actually golden hour. The clot busting medications and mechanical thrombectomy, if happens in this period, if blood circulation is re-established, the chances of better outcome is much higher. And why this is called golden hour? After blood circulation reestablishes, the brain previously affected gets blood circulation, nutrition, and there will not be any further neuronal death. This is possible by stent retrievers. Stent retriever is like a basket-like device, and procedure is called mechanical thrombectomy. Mechanical thrombectomy is a new modality in the interventional stroke treatment where mechanical force is applied to remove the blood clot by either aspiration or approaching through basket-like device called stent retriever. Treatment. In recent years, the comprehensive stroke treatment units or stroke care are helping the people who are affected by stroke and maximizing the recovery. A comprehensive stroke unit team consists of emergency physician, neurosurgeon, neurologist, neuroendovascular surgeon, intervention neuroradiologist and neuroanesthetist and physiotherapist. Once the stroke affected patient is taken to emergency, he or she is neurologically assessed in the emergency by neurologist, neurosurgeon and emergency physician. The patient will be evaluated and treatment is started, neuroimaging is done. If patient gets admitted within 3.5 hours of stroke, he or she will be provided clot busting medication. If patient reaches beyond 3.5 hours of stroke, then clot within the blood vessel of the brain is removed mechanically by basket-like device or stent just now we discussed. In this procedure, blood clot inside the blood vessel is removed and blood circulation is established through the device. It will be like almost like a slightly thicker than the hair. It is called micro catheter and micro guide wires and stent retrievers pass through groin puncture. It is performed by endovascular surgeon or intervention neuroradiologist who is trained to perform endovascular procedures. Before the advanced stroke treatment or endovascular stroke treatment came into the picture, what we were doing? The conservative treatment was the only option. It was showing many cases where patient suffered and lost their lives and left with a permanent disability like hemiplegia or complete bedridden states, and the tendency to develop weakness in the hands, legs, speech dysfunction and persistent vegetative state. There was high morbidities and high probability of self dependency on a wheelchair or stretcher dependent on the family for a prolonged time and developing bed sores, sepsis and subsequently death. And these are more common with the conservative treatment of brain or stroke treatment. If any patient comes after the golden hour period, the right treatment cannot be started. On seeing the symptoms or warning signs like facial weakness, leg weakness, speech dysfunction, the patient should rush to or attender should take the patient and rush to hospital immediately without any delay, even single minute or second. Hence, remember and create the stroke awareness on this October 26th. My request is to create the awareness. Those who develops warning signs like facial weakness, arm weakness, speech dysfunction, it's a time to reach the stroke care unit or comprehensive stroke care unit hospitals immediately as early as possible to start the treatment in the golden hour. Thank you for listening to it. Have a nice day. Namaste.